Hi, I'm Dr. Sebastian Gonzalez, and this month I want to focus on plantar fasciitis. Plantar fasciitis is, you probably think foot pain when I say plantar fasciitis, and that's exactly right. But you know, I think the term is tossed around very loosely among healthcare providers. When you come in to see many healthcare providers, they'll talk to you about foot pain, and you start pointing at different spots of the foot, and they'll say, yes, you have plantar fasciitis, but there are very few people that I've seen come in that actually have plantar fasciitis, inflammation of the plantar fascia. This injury is very common amongst runners, long-distance runners, people that are on their feet all day, have bad shoes, warehouse workers, those type of people. They can develop foot pain, but I really want you to focus more than anything else. If you remember one thing from this webcast today is that not all foot pain is plantar fasciitis. So they all merit different types of treatment. So I want you to know the plantar fascia, and this is the inside part of the foot here. Plantar fascia is a sheet that goes from here to here. It's rather thin. You can probably extend your toes back on your own foot and you can probably feel a tight band pop up. That's that plantar fascia. Many people walk into a doctor's office or other healthcare providers that they kind of point different regions of the foot. They say they have plantar fasciitis more along the outsides. They have foot pain and they get that plantar fasciitis diagnosis. But fact is, this isn't the plantar fascia. There's other muscles of the foot, small intricate muscles that can be overused from improper drive, like when you're running, you're not using your calf as much as you should be, so you kind of get that clawing motion when you're running. So these muscles cramp up, develop scar tissue, and they also develop pain. So more than anything else, please, please, please understand that plantar fasciitis is not any kind of foot pain. It's a very specific type of foot pain, and other things need other types of treatment if they're not plantar fasciitis. Again, let me focus real fast on why foot pain can develop, especially with athletes. So there's a huge muscle in the back of your calf that attaches to your big toe. This muscle is called the Flexor Hallucis longus. It's the one that flexes your big toe. It produces a lot of drive when you're running. If you don't have this muscle functioning properly, you're going to develop things like foot pain, even knee pain, hip flexor tightness, low back pain. All this stuff can come from this one tiny little muscle. Well, tiny relative to other muscles, but down in this proximity it's rather large and important. So I want you to understand that if that's not working, and we're going to talk about foot pain again here, is that you're going to start clawing using the smaller, weaker muscles of your foot that develop scar tissue. Scar tissue is the body's natural way of healing small tears, even large tears, but with overuse injuries, usually smaller tears, and this scar tissue buildup, if you can imagine a muscle usually stretches like a rubber band. That's a normal functioning muscle. It stretches really well. Now, the section that has scar tissue, and all muscles have this if you had some type of injury or overuse injury, is this section of muscle will have a lot more scar tissue. It's more fibrous, it doesn't stretch well. So just imagine stretching, you're stretching on your own now, stretching this normal muscle, and then this section of the muscle is like a rope and it just doesn't stretch, okay? Stretches well, doesn't stretch at all. So a lot of times you need a manual therapist to go in there and break up this scar tissue before you can effectively stretch it on your own. Common treatments for foot pain or plantar fasciitis are, a lot of times people get orthotics. They just get told not to do what they're doing, like runners. They just get told to lay off on their mileage. Stretching, injection therapy, or very minimal times they get surgery. And I want you to listen very closely to this, is that 95% of the people that develop plantar fasciitis will find significant relief with non-surgical methods. So 95% of the people that get plantar fasciitis will respond to non-surgical treatment. However, of these people, a lot of times it's not uncommon to find relief only after about a year, even 2 years. So a lot of traditional treatments, they will work, but it takes a long time. Now, I spent some time talking about the other types of treatments and what causes it, but now I want to focus a couple minutes on what I think is the best type of treatment. It's called active release technique, or ART. I am an active release provider, so I'm probably biased in my opinion, but I've seen so many phenomenal cases come through that people that are runners that have had orthotics, injection therapy, they've tried ice, rolling on a cold water bottle, all this stuff on their own or other places, and they've still found better results with active release than anything else. Active release is a very specific type of manual therapy that, like I said, is very fast and effective. I tell most of my patients, if you're not feeling within 4 to 6 treatments or so that this is working, you can feel free to leave, because after that amount of time, there's no reason why you should not be coming back to me saying that, hey, I don't know what you did last time, but it really worked, and you please do it again, okay? I want you to feel like your treatment's working. There's no reason why you should have foot pain for a year to 2 years, okay? If you'd like more information on active release technique, please visit my website. Please give it a shot. More than anything else, I want you to know that the two things in the presentation, number one, plantar fasciitis, a lot of times it's just a very loosely used term, so please be specific with what type of pain you have and tell your medical professional. Also, number two is that there's no reason why you should have foot pain for a year to 2 years, and also surgery is usually not recommended for this type of treatment. Thank you, and please visit the website if you'd like more information.